So if you've injured your knee or your quads are tight or your hemis are tight, there's some great acupressure points that you can use to help reduce the pain. So if this is sore or it's swollen and you don't want to injure yourself, then the first kind of points you can start with are just by massaging the opposite shoulder. So this will start from a Chinese medicine point of view to release and get some blood flow through the tissue. My suggestion is you come through, you massage through there, and then if you work your way down your opposite bicep, this in turn starts to relax the quads, not the quads, sorry, the hemis. And in Chinese medicine, we talk about, once again, the interconnectedness of the body. So there's some great traditional points that we use in the hand that'll help activate the muscles in the hip, which will protect the knee, but also get the quads to fire better, hemis to fire better, and the swelling underneath the knee better. So, always nice and gently, but on the opposite hand, starting in between these bones, working our way through. You're probably going to find a few tender spots. If you do, just stop for 30 to 90 seconds and just hold. As you hold it, you should actually start to feel that release, and then move on, coming all the way through. There is the classic point for pain throughout the whole body in Chinese medicine, large intestine 4, that you can just massage here. Traditionally, we don't use this if you're pregnant, so if you're pregnant or looking to get pregnant, just don't do it. Now, so that's, you've started with that, so there should be nice blood flow through there, and now you want to get in and massage some of the spots around the knee itself. Once again, if you've done a tear or you've damaged some ligaments or anything like that, good rule of thumb is make sure you check with your doctor or like your primary care, so you're not doing any kind of mischief to yourself. But just by massaging, I'll bring my pants up. So you've got the tendon that comes through here, but just by getting in and massaging the tendon, and then moving to what Chinese medicine calls the knee eye, which is below the kneecap but above that bone there, we're trying to stimulate some blood flow into the capsule itself. And if there is any mischief in there, by massaging it, it'll break up any kind of scar tissue, get some fresh blood, and then you're going to come around to the side. These are where like your MCL, like your medial collateral ligament is, on the opposite side MCL. So obviously if you have an injury there, make sure you're being gentle and you're outside of that kind of time when you want to let them heal. Talk to your carer, about a minimum 2 weeks, sometimes longer. But gentle massage through there to help some blood flow. And then you're going to do the same underneath the knee. The main muscles that are going to get sore and tight if you have any knee mischief is this muscle called vastus medialis, or the VMO. It shuts down and can lose some muscle size quite quickly if there is some swelling in there. So right in that teardrop that you're meant to have, there's a traditional acupuncture point where if you massage, it should help get some fresh blood through there, release the muscle, and help it kind of activate in the future so it feels better. But if there is an injury, like I said, this one shuts down, but usually the opposite one goes really tight. So that same point, but on the other side, just above the knee, you can use that and massage down a whole line through there, finding any of the tight, sore bits. If you do, you can stop and hold for 30 to 90 seconds. You should feel it release underneath you, and then coming all the way up into the... You're going to feel a lot better with that. If your hemis are tight, you can get a ball into there, or you could like roll it and things like that. But let's imagine you don't have any of those things. You're just sitting on the floor or on the lounge. You can just work your way through the thigh. Nice. All the way up, finding those tight bits of the muscle belly. You don't need to go bananas, but just by massaging it, you're going to be stimulating some blood flow. It also helps reduce some pain as well. And if you can do that every night, you're going to help facilitate some healing. If you've done some mischief to your abductors, same idea. Start on the side and just working your way through. Coming all the way up. And that'll do it. That's pretty much, you've relaxed the whole neck, whole quad. You've got some blood flow through the whole joint. You've covered most of the tendons, and you'll feel good doing it.